Hey guys, today we're going to talk about somebody with knee problems, arthritis of the knee pain, having trouble walking, whatever it may be. So what I want to do today, I want to go ahead and explain two different x-rays here and explain what can actually be done to help these types of problems without getting surgery. So let's just look here. We got figure one. This is a normal knee. Okay. Figure two. This is a knee that has osteoarthritis. Someone has knee pain. Someone has trouble walking. So this is obviously a problem. Now I'm going to go over and explain the different parts of this. Now we know that every joint needs to function and move properly. If it doesn't function and move properly, it starts to break down, which causes arthritis. Okay, so let's just go ahead and look at figure one here. You can see how the knee, you can see the joints right here, the joint space. That's a nice even joint space right there. That's what we want to see. That's healthy. Okay, there's soft tissue all in between here. Okay, that's healthy. That knee is moving properly. Now, let's go ahead and look at figure two. Now let's just look here. Now you see the nice smooth spaces over here. Now let's look right here. Look how that's actually coming down. Look how it's all chewed up looking. It's all white. Look over here. Look how close that is. Now you always hear the expression bone on bone, or your osteophytes, or you have bone growth. Okay, this is the types of things we're talking about. So if you can see here, it says bone spur. Look down this part of the bone. It actually points out right here. Okay, because what your body actually tries to do, it'll actually try to fuse this area because your body tries to protect itself. It's very smart. So if the knee joint isn't moving properly over time, the constant stress, us walking, whatever it may be, playing sports, working out, if our knee isn't functioning properly, it starts to break down. Okay. So now what's happening to this soft tissue in here? Now this knee it's a hinge joint. Okay, so it actually moves like this. Okay, that knee moves just like this, just like a hinge joint. Okay, it moves back and forth. Now, all this soft tissue in here, if it's not moving properly, that soft tissue is literally ripping and tearing inside of there. So literally every step you take, what happens? It breaks down, it's ripping and tearing. Okay, so that's obviously not a good thing. We need to make sure we get this joint functioning better, and we need to stop that from breaking down. Okay, so the question is, how exactly do we do that? Well, we obviously want to keep you away from surgery. Surgery is the absolute last thing we ever want to do. Knee replacement, last thing we want to do. Okay, so what we can actually do with a knee like this, we can actually put a substance in there that's basically like oil. So you know how I told you about the friction in that knee whenever the knee joint moves, breaking down that soft tissue? Now we can put something in that knee joint. It's like oil, just like if you put oil in your car. We need that lubrication. So that lubrication will stop that from grinding, ripping, and tearing. Okay, now the next step is we have specialized bracing. Okay, for example, you see how this one is pinched, this joint. Now what we can do is have specialized bracing to actually draw this knee this way to open up that disc space. Okay, so imagine how powerful that is whenever you start opening that disc space up, taking the pressure off that joint. So you're talking about staying away from surgery and knee replacement. This is the ways that we help our patients. We can literally open up that joint space. Okay, so right there, that stops breaking down, because that's the key. We want to stop it from breaking down. We want to stop it from deteriorating. Okay, now what we want to do after that, so what we'll do, we'll put our patients on a certain exercise regimen. So the next steps, the next phase will be a stretching phase, which we can actually start doing therapies and doing stretching to regain that normal motion, or close to the normal motion, depending on how bad your knee is. And the next step after that is a strengthening phase, so it actually stays moving that way. Okay, so because we need to make sure that knee joint stops breaking down, we need to make sure it stops deteriorating, so then that way there you can actually walk normally. You don't need a walker. You can walk up and down steps, things like that. We have to take care of our bodies. So just to give you an example, these are the types of things that we do in our office. If you're having knee pain or you're having problems, there are things that you can do. So please make sure you explore those things what I talked about today. Thanks.